So today we will be focusing on the topic Neisseria gonorrhoeae and Neisseria meningitidis.
Hey Pinky, what's up?
Hi Keisha, so from the other day I just don't feel well,
All the time I call you something right, you can never go right. So tell me what's wrong. Remember me, a friend from long time now. You can tell me anything.
It's a little thing going between me and John though, and from that, I just don't feel well. I just start feel sick.
You mean John from down south? Tall John with the watermelon face
Yeah.
and body shaped like champagne buckle? This must be a joke. Feel sick, how my friend?
I have itching, burning when urinating, yellow discharge, and John, I was afraid to ask him, but then I managed to ask him, and he said he only have burn when he's urinating.
But Pinky, that sound like gonorrhea to me.
Keisha, you know how long me and your friend, what kind of gun you talk about? If me dey have one gun, you know what I know? And John is a good man. He is a good man. He's not a bad man. He not have no gun.
No, man. I said gonorrhea. It's a sexually transmitted infection, man. It is caused by a bacteria. So all the symptoms that you're having are ways in which you know if you have the infection.
Oh.
You don't have to panic, man. It can be treated by getting antibiotics from the doctor. The medication, me not think it that expensive. So you and
Okay.
John can go to a doctor and go get advice and treatment. And next thing, when you get the medication, make sure you take them off.
Yeah.
And next time, a condom.
Okay. But Keisha, I never know say a turn doctor or is a Google doctor. But anyways, I'm glad for the information. You're a good friend. Trust me. And you know your thing them. So I'm gonna go to the doctor, and as soon as both me and John go and come back, I'm going to call you and let you know and tell you everything that the doctor said. And I will definitely take my medication because I don't want anything worse to happen. All right?
You can't afford that, man.
True, true.
All right, we'll catch up one next time.
Yes, all right. When I come back from the doctor, I'll call you.
All right, take care.
All right, you too. Bye-bye.
Neisseria gonorrhoeae. What is Neisseria gonorrhoeae? Neisseria gonorrhoeae is a bacterial pathogen responsible for gonorrhea and various sequelae that tend to occur when asymptomatic infection ascends within the genital tract or disseminates to distal tissues.
Neisseria gonorrhoeae is a gram-negative obligate fastidious diplococcus bacteria, like all gram-negative bacteria. Neisseria gonorrhoeae possesses a cell envelope composed of an inner cytoplasmic membrane, a middle layer of peptidoglycan, and an outer membrane.
The outer membrane contains lipolignosaccharide, LOS, also called endotoxin, phospholipid, and a variety of proteins that contribute to cell adherence, tissue invasion, and resistance to host defenses. Neisseria gonorrhoeae has many dynamic polymeric protein filaments called type 4 pili, which allow the bacteria to adhere to and move along surfaces. It is caused by the bacterium Neisseria gonorrhoeae. This gonorrhea bacteria are most often passed from one person to another during sexual contact, including oral, anal, or vaginal intercourse.
Signs and symptoms in men. Signs and symptoms of gonorrhea infection in men include painful urination, pus-like discharge from the tip of the penis, pain or swelling in one testicle. Signs and symptoms in women. Signs and symptoms of gonorrhea infection in women include increased vaginal discharge, painful urination, vaginal bleeding between periods such as after vaginal intercourse, abdominal or pelvic. Signs and symptoms in the rectum include anal itching, pus-like discharge from the rectum, spots of bright red blood on toilet tissue, and having a strain during bowel movement. Signs and symptoms in the eyes. Gonorrhea that affects your eyes can cause eye pain, sensitivity to light, and pus-like discharge from one or both eyes. Signs and symptoms in the joints. One or more joints become infected by a bacteria or septic arthritis. The affected joints might be warm, red, swollen, or extremely painful, especially during movement.
Diagnosis. Gonorrhea can be detected by the following. 1. Urine test. This can help identify bacteria in your urethra. 2. Swabbing of affected area. A swab of your throat, urethra, vagina, or rectum can collect bacteria that can be identified in a lab. Prevention. Use a condom if you have sex. Limit your number of sex partners. Be sure you and your partner are tested for sexually transmitted infections. Don't have sex with someone who appears to have a sexually transmitted infection. Consider regular gonorrhea screening.
Treatment. Adults are treated with antibiotics. Due to emerging strains of drug-resistant Neisseria gonorrhea, the Centers for Disease Control and Prevention recommends that uncomplicated gonorrhea can be treated with the antibiotic ceftriaxone given as an injection with oral azithromycin, Zithromax. If you're allergic to cephalosporin antibiotics such as ceftriaxone, you might be given oral gemifloxacin, Factive, or injectable gentamicin and oral azithromycin.
Neisseria meningitidis. Meningococcal infections are caused by a group of bacteria called Neisseria meningitis. The most common form of meningococcal infections include meningitis, infections of the membrane that surround the brain and spinal cord, and bloodstream infections. Meningococcal infections are rare and may be serious. Gram-negative. Neisseria meningitidis are gram-negative, coffee bean-shaped diplococci that may occur intracellularly or extracellularly in PMN leukocytes.
Causes. Bacteria called Neisseria meningitis cause meningococcal disease. About 1 in 10 people have these bacteria in the back of their nose and throat without being ill. This is called being a carrier. Sometimes the bacteria invade the body and cause certain illnesses, which are known as meningococcal disease. Symptoms. In the central part of the head, you experience symptoms such as headache, altered mental status. In the ears, phonophobia. In the eyes, photophobia, stiffness of neck, systematic high fever. Diagnosis. It can be difficult to diagnose because the signs and symptoms are often similar to those of other illnesses. If a doctor suspects meningococcal disease, they will collect samples of blood or cerebrospinal fluid near the spinal cord. They then send the samples to a laboratory for testing. If Neisseria meningitis bacteria are in the samples, laboratorians can culture the bacteria. Growing the bacteria in the laboratory allows doctors to know the specific type of bacteria that is causing the infection. Knowing this helps doctors decide which antibiotic will work best. Other tests can sometimes detect and identify the bacteria if the cultures do not. Treatment. Meningococcal disease is treated with a number of antibiotics. It is important that treatment starts as soon as possible. If a doctor suspects meningococcal disease, they will give the patient antibiotics right away. Antibiotics helps reduce the risk of dying. Depending on how serious the infection is, other treatments include breathing support, medication to treat low blood pressure, surgery to remove dead cells, wound care for parts of the body with damaged skin.
It all start with a kiss in a bed, no condom. What is this? Days later, private start, itch go a panic, ask doc. What is it? Gonorrhea, the bacterial pathogen. Lord, look here, watch problem. Gram-negative bacteria caused by bacteria. Neisseria. Doc, it all dep on fire. Burn it a burn me a twist and turn all yellow discharge. Neck lymph nodes enlarge. When me ever do can it be treated? Him say yes by using antibiotics, ceftriaxone, the injection, and gemifloxacin. Alright, doc. Thanks for your time. Practice safe sex and stay in line. Gonorrhea, the STD, stay bacteria free.